At this moment, I would like to thank everyone for your time and attention in allowing me to present scoliosis disease as it affects age 18 to 65 years old. My name is Carlene Braun. What is scoliosis? Scoliosis is defined as a lateral curvature of the spine, a deviation of the spine greater than 10 degrees in the coronal plane. The curvature starts at the lower back to form a S shape or a C shape. This curvature can be either forward or backward. Scoliosis causes the ligament of the spine to become brittle and also weak. This disease process affects about 2% of the general population. Anatomy and classification of scoliosis. In order to understand scoliosis symptoms and treatment choices, let's start with some understanding of the general anatomy of the spine. By becoming familiar with the various parts that make up the spine and how they work together, it facilitates ease and also familiarity. A brief anatomy of the spine. The spine consists of 24 small bones or vertebrae that are piled on top of each other to create the spinal column. According to Gelb, each vertebrae is a soft, gel-like cushion called a disc that helps absorb pressure and keeps the bones from rubbing against each other. Each vertebrae is held to the others by groups of connective tissues called ligaments. The ligaments connect bones to bones, while tendons connect muscles to bones. The joint in the spinal column are called facet that links the vertebrae together to give them the flexibility to promote movements amongst each other. The stacking of the vertebrae on top of each other creates a hollow tube that anchors and protects the whole spinal cord, and its surrounding nerve roots. This intact system conveys message from the brain to the rest of the body to maintain proper body functioning. The stacking of the vertebrae on top of each other creates a hollow tube that anchors and protects the whole spinal cord and its surrounding nerve roots. And as mentioned before, it maintains body function. As the nerve root branches off and exit the spine through spaces called neural foramina, each segment of the body, such as the cervical spine, the neck, the thoracic spine, the chest area, and the lumbar spine, which is the back, and the sacrum that connects the spine to the pelvis region. A normal spine is viewed as an S-like curve when looking at it from the side, which allows for an even distribution of weight and aids in all kinds of stress. The cervical and lumbar spine have an inward curve, while the thoracic spine curves outward. Each portion or segment of this musculoskeletal system relies on each other's strengths to function properly in maintaining body mass. Classification. Scoliosis can be classified as either idiopathic, which is of unknown causes, hereditary, or from some other source, degenerative adult scoliosis, which mainly consists of a degenerative process seen in older adults. Could be from osteoporosis, could be from injuries, spinal injuries, traumatic injuries, or some form of degenerative process. For this presentation, the primary focus will be geared towards degenerative scoliosis as it affects age 18 to 65 years old. A brief overview of idiopathic scoliosis. This is a type of scoliosis also seen in teenagers. It Its cause is unknown, but it has a genetic basis and may be a combination of abnormal development of bones, soft ligaments, or weak muscles, or an abnormalities with the inner ear and balance function. In some cases, an already diagnosed curve progresses or begins to cause symptoms in adulthood. In other cases, it is not diagnosed until adulthood. For degenerative adult scoliosis, this degenerative process occurs when the combination of age and deterioration of the spine leads to the development of a scoliosis curve in the spine. Degenerative scoliosis begins after the age of 40. In older patients, particularly women, it is also often related to osteoporosis. The osteoporosis weakens the bone, making the bone more likely to deteriorate. The combination of these changes causes the spine to lose its ability to maintain a normal shape. The spine begins to sag, and as the condition progresses, a scoliotic curve can slowly develop. Again, depending on the spinal levels affected and the severity of adult scoliosis, certain physical characteristics may exhibit or develop, including deformity, lack of symmetry. For example, one shoulder or hip may appear higher than the other. Trunk imbalance may cause the patient to appear to be listing to one side, like a leaning position. Scoliosis can affect one leg to become longer than the other and cause walking difficulties. For example, I just list a visual description of what a normal spinal posture should look like. And when the patient has this scoliotic process, you can see how the spinal column and the body is distorted in shape. Scoliosis affects the entire body system. It affects the hematopoietic and cardiovascular functions. It affects respiratory functions, fluid electrolytes and urinary functions, reproductive and endocrine functions, gastrointestinal, musculoskeletal, neurosensory functions, as well as integumentary and body defense functions. So I will review briefly just each of the topics to give an overview of how the body system function and how the disease process affects each systems. So scoliosis disease mainly affects the musculoskeletal system, but there are implications of vascular problems that may arise as a result of treatment options. The blood supplies cells with water, electrolytes, nutrients, and hormones, and remove waste product. The cellular element supplies oxygen, protect against foreign body organisms and antigens, and initiate coagulation and platelet functions. For patients suffering from severe scoliosis, if left untreated, it heightens the risk for cor pulmonale, which is a cardiovascular disorder. It's also called a right ventricular hypertrophy. Cor pulmonale disorder is also cor pulmonale is also called a right ventricular hypertrophy. This process occurs at the end stage of various chronic disorders that affects lung function as well. Scoliosis disease exhibits restrictive conditions of the chest wall and decreases lung function because of the increased workload, Pulmonary hypertension increases the workload of the heart. In order to compensate for this excessive work on the heart and the lung, the right ventricular hypertrophies causes blood to force through the lungs. This initiates a compensatory mechanism which causes larger amounts of blood to remain in the right ventricle at the end of diastole and causes the ventricle to dilate. In response to hypoxia, decreased oxygen in the tissues, the bone marrow produces an abundance of red blood cells known as polycythemia, which becomes viscous and further aggravates the pulmonary hypertension, thus cause an increased risk for right ventricle workload and can result in heart failure. Um, Impact on the respiratory system. The respiratory system, according to Story, provides vital oxygen and removes toxic carbon dioxide through the act of breathing. This system of gas exchanges consists of two major divisions, air conducting and gas exchanging system. As we breathe, this allows for the exchange between oxygen and carbon dioxide gases to occur. As Story further explained, oxygen is necessary for the cells to produce energy through cellular metabolism, while thus providing a pivotal role in maintaining the body's homeostasis. Worsening scoliosis causes an increased sideways curvature of the spine, significantly alters the shape of the thoracic cage and diaphragm. By this limitation, it causes a decrease in the vital capacity, the amount of air that you can inhale in 1 minute or breathing cycle. Vital capacity is the maximum amount of oxygen a person can expel from the lungs after a maximum inhalation. It is equal to the sum of inspiratory reserve volume, tidal volume, and expiratory reserve volume. By creating a limitation in vital capacity, an asymmetrical inspiration and decreased chest wall compliance is noted. The extent to which lung volumes are affected is related to the severity of the disease process. Physiological dead space will tend to increase while tidal volume decrease to establish a relationship or dead space ratio, thus causes an overall increase in the risk for carbon dioxide retention for this. Fluid electrolytes and urinary function is also affected by this disease process. Fluids within the body are distributed among functional compartments or spaces and provide a transport medium for cellular and tissue function. Fluid fluctuations will affect blood volume and cellular function. Disturbances in these functions, according to McCain et al., are common and can be life-threatening. Acid-base balance is critical for health and is achieved through a complex buffer system. Fluid intake, according to Story, should equal the amount lost or the amount that is consumed should equal the amount that is expelled or urinate. When fluids become excessive, it accumulates in the interstitial spaces, intracellular and intravascular spaces, and create pathological changes. For patients suffering from scoliosis, fluid accumulation will increase edema and fluid shifts to affect the cardiovascular and respiratory system, as well as other vital organs such as the urinary system, which helps to regulate volume. The The abnormalities in the structure and function of the reproductive and endocrine system is affected as well by this disorder. In patients with idiopathic and degenerative scoliosis, it signals investigative reasoning. These systems are responsible for multiple body functions. The reproductive system in males and females, according to Story, are responsible for the procreation and hormone balance for this population. Maintaining a good reproductive health can decrease the likelihood of issues within this system. Women who have been successfully treated for scoliosis, according to Zeev, have only minor or no additional risk at all for complications during pregnancy and delivery, which is very good considering the restrictive process and the deviation in the spinal column. A history of scoliosis does not endanger the child. Pregnancy itself, even multiple pregnancies, does not increase the risk for curve progression. Women who have severe scoliosis that restricts the lungs, however, should be monitored closely. Like the reproductive system, scoliosis also affects the endocrine system. And the endocrine system is responsible for producing and secreting a wide range of hormones and chemical transmitters to aid in the regulation of body's growth and development, metabolic changes, sexual and reproductive functions. The endocrine system is responsible for hormones that are necessary for a variety of processes. In scoliosis patients, the endocrine system is known to secrete hormones such as calmodulin, which is a calcium-binding receptor protein that regulates the contractile properties of muscles and platelets. Increased calmodulin levels in platelets have been shown to be associated with worsening of scoliosis processes. Melatonin binds to calmodulin and has been shown to act as a calmodulin antagonist for that reason. Patients with idiopathic scoliosis are often taller than aged match-controlled subjects. Scoliosis also affects the gastrointestinal system as well. For multiple functions of the body, it affects the system causing the body to have a disability to perform functions such as ingestion, absorption, and elimination of waste products. Story argues that this function obtains the essential nutrients, water, and electrolytes the body needs to maintain many physiologic activities and homeostasis. When patients with scoliosis, as the symptoms and deformity become severe, it alters the body function as well by causing suffering from pain, trouble walking, numbness in the body, breathing troubles, digestive problems. Regardless of the pathogenesis, GI disorders often create short or long-term nutritional deficits or elimination issues that can affect the individual's overall health. Um, Musculoskeletal system, which is the major system that is affected by this disease process, and musculoskeletal system is essential in facilitating locomotion and balancing. So musculoskeletal system gives the human body form and stability while protecting the body's vital organs. If the musculoskeletal system is altered, um, it won't be able to perform in assisting in homeostasis and hematopoiesis. So with scoliosis patient, the impairment affects the musculoskeletal function by inducing the perturbations to standing balance because of the vertebral column is so deformed at the thoracic level as well as the lumbar level or both. Depending on the severity and progressiveness, scoliosis impedes on the movement of the ribs, places the respiratory muscle at mechanical disadvantage, and displaces various organs of the thoracic cavity. Scoliosis also affects the neurosensory functions of the body. The nervous system is central in controlling many of the body's functions. It collaborates with the muscles, organs, and glands to regulate heart rate, blood flow, breathing, and as well as digestion. The nervous system helps the body to get rid of waste products such as urination and defecation. Story explains that the nervous system works with other systems to maintain homeostasis by receiving and responding to input from the environment. The sensory system functions like a surveillance system that senses changes in the internal and external environments. Sensory function respond to various internal and external stimuli. So when they are stimulated, receptors will send signal to convert the stimuli into nerve impulses by mechanoreceptors, chemoreceptors, thermoreceptors, photoreceptors, nororeceptors, which is painful stimuli. These surveillance systems are located throughout the body's nerve endings in the skin, in the bones, and internal organs. For patients with scoliosis disease, the vertebral column houses a multifaceted sensory response system. Every aspect of movements, form, and function. This ability allows the sensory system to detect deformity of the spine and translate into diverse pathological consequences. Normal human spine is programmed to assume a wide range of positions, including curvatures to the left or right in response to stimuli. In scoliosis patients, the functional curvature becomes habitual by conforming to a lateral position secondary to induced stress, pain, or injury that was never treated appropriately, and as a result, the deformity may become permanent unless surgically corrected. In some instances, it can be corrected with change in posture, but as the body ages, the overall flexibility of the spine will also decrease. In some individuals, scoliosis can progress to a complex three-dimensional disorder, deforming the entire chest or thorax. According to EB, the progression of the curve is supported by osteoporosis, particularly in mid 40 to 65 years or postmenopausal female patients. These patients present themselves predominantly with back pain, then leg pain, and claudication symptoms, but rarely with neurological deficits. Scoliosis also affects the integumentary and body defense function. And for the overview, I will present it in future slides. So, impact on developmental milestones for population age 18 to 65 years old. Population age 18 to 65 years old suffering with scoliosis disease. Curve progression greater than 10 degrees generally occurs more rapidly during the first 5 years of life and again during adolescence growth period. The process slowly progresses to a chronic degenerative stage onwards into adulthood or adult development stages. In the normal spine, growth occurs symmetrically at the end plates on the upper and lower end of the vertebrae, leading to balanced spine in both coronal and sagittal plane. In the presence of a vertebral anomaly, there is imbalance of growth plates on either side of the spine, resulting in localized unilateral longitudinal growth imbalance and leading to an increase in spinal deformity throughout the developmental milestone from adolescence to adulthood. So, as the disease process progresses, it most commonly affects, you'll see the effects on female than in male patients. In older patients, particularly women, it is also often related to osteoporosis because of changes in body's hormone, calcium deficiency, and lack of certain environmental or physical characteristics such as exercise. Osteoporosis weakens the bone, making the bone more likely to deteriorate. Combination of these changes causes the spine to lose its ability to maintain a normal spine. The spine begins to sag as the condition progresses, and a scoliotic curve slowly develop. In a study done by Dr. Cindy Walker in 2003, she discovers that many patients had long-term physiologic impact associated with scoliosis treatment. Some of the symptoms and chronic conditions that resulted from the body image disturbance and poor coping mechanisms were identified as female mainly experience emotional distress, discomfort during physical activities, anxiety, fear, and social withdrawal. The male counterpart or male patient with scoliosis, reports show that they were less healthy. Body image disturbance was of significant concern. Some had suicidal ideation, and decreased peer relationship as well as increased alcohol consumptions. In conclusion, as you can see, scoliosis disease is not a discriminative disorder. It affects the adult population as well. Degenerative process such as osteoporosis is affected by this disorder as well. Other conditions such as back injury, spinal injury that causes decreased flexibility and mobility are known causes of scoliotic process. So I'd like to thank you very much for your time and your attention in allowing me to present my information. And hopefully from this presentation, you will have a good understanding of the scoliosis disease and how it affects the human body. Thank you.